I will be talking to you about acute kidney injury today. Acute kidney injury or acute renal failure as it was known before is a reversible condition if there is a damage to your kidneys. It can range from minor reduction in kidney function to a total shutdown. It is very important to identify this earlier in order to reverse the condition totally. There is a serious kidney injury that can be accumulation of water and salts which can damage the body. The symptoms of acute kidney injury can be varied. It starts with nausea and vomiting. This can lead to dehydration. There can be a high blood pressure. This leads to fluid in lungs, which is called pulmonary edema. It can also lead to abdominal cramps. People at risk of having acute kidney injury include age over 65 years of age, if they have a pre-existing illness like diabetes, chronic liver disease, or a heart disease. People who take over-the-counter medications like painkillers and other antibiotics are at risk for developing an acute kidney injury. If you have a serious illness like sepsis, this can also lead to acute kidney injury. Acute kidney injury can be classified as pre-renal, renal, and post-renal. Pre-renal includes conditions which there is a reduction of the blood volume. This can be because of either diarrhea or vomiting and dehydration. If there is a blood loss because of any injury and any condition in which there is a low blood pressure. Post-renal causes include stones, an enlarged prostate, or any malignancy involving the kidneys and urinary bladder. The renal causes are varied. It can be from a simple glomerulonephritis to a more severe illness of the blood vessel called vasculitis. Another cause of acute kidney injury is the use of contrast media in radiological as well as certain cardiological procedures. These media can get accumulated in the kidney and lead to acute kidney injury. After diagnosing acute kidney injury, it is always important to find out what is the underlying cause. If it is a pre-renal condition because of dehydration and loss of blood volume, the same has to be replaced immediately. Renal causes will need something like a kidney biopsy in order to diagnose what the condition is. When should kidney injury be suspected? When a patient suddenly falls ill or he has symptoms like reduced urine volume in spite of good amount of fluid administration, or if there is a difficult for him to pass urine and he needs some help in order to achieve this. At that point of time, we have to suspect there is acute kidney injury. Diagnosing an acute kidney injury is fairly easy. If you have a suspicion of reduced urine volume, you can always do an urine analysis in order to know the type of kidney injury. You can also do a blood test called creatinine and other tests like urea, which will indirectly tell us how much of kidney function has been deteriorated. A new classification which is under the term rifle, which indicates R for risk, I for injury, F for failure, L for loss of kidney function, and E for end-stage kidney failure. So based on the urine volume and creatinine, the severity of the injury can be identified. Treatment for acute kidney injury should begin as soon as possible. Minor degrees of acute kidney injury can be treated at the outpatient basis. However, more severe degrees of acute kidney injury needs hospitalization for more fluids as well as to treat the underlying cause. Treatment of acute kidney injury can be more serious. There is involvement of other organs as well. In such situations, they might have to be put in the intensive care unit for close monitoring as well as for special treatment in order to reduce the complications of acute kidney injury. Major complications of acute kidney injury include fluid in the lungs, which is called pulmonary edema. They can develop very high levels of potassium, which is called hyperkalemia. This can lead to disturbance in the heart rhythm. They can also have retention of water, which can lead to severe edema and other complications because of this. Acute kidney injury is a reversible condition. Hence, we should take every effort to prevent it from happening so that we can avoid the complications associated with it. It is always important to identify the underlying cause and treat the underlying cause immediately because it can reverse the kidney functions. People who are at high risk need to be monitored very frequently and they should consult a doctor and do the tests regularly in order to identify early change in kidney functions. It is very important to know that dehydrated kidney is more risk of developing acute kidney injury. So hydrate yourself very well, especially during summer months, so that you can prevent yourself from developing this complication. If there is an obstruction to the urine flow, it is important to identify as well as to take the treatment appropriately, because an obstructing kidney is likely to have damage which can persist for many months. So let us take care of our kidneys, and we take a pledge, we will treat you well.